Thank you, Dr. Stoner. Good afternoon. I'm Dr. Bender. I'm here to talk today about the disease of addiction through the current pandemic. This has brought challenges, unique challenges to all of us, but especially to people who are struggling with substance use disorders and alcohol use disorders. The National Center for Drug Abuse Statistics showed in 2018 that between 20 to 30 million people in the United States suffer from a current alcohol use disorder or substance use disorder. About 14 to 15 million of those primary diagnosis is alcohol use disorder. We have seen statistics showing sharp increases in alcohol sales in the United States, but there's also mixed evidence showing that while some people are drinking more, others are drinking less. Regardless, the disease of addiction is brutal enough, even in the face of normal times, but in times of increased isolation, addiction can really feed off of that. Addiction is a disease that thrives in isolation, and one of the treatments for addiction is social connectedness. And during these times, it's incredibly difficult for people suffering from addiction to be socially connected for obvious reasons. So one thing that I wanted to talk a little bit about today is what we can do to maintain sobriety during the course of this pandemic. And I reached out to old colleagues and friends of mine and people I know that are in recovery and kind of just asked them what they thought and what they were doing to maintain their sobriety during these tough times. So I want to share some of that with you today. If you're at home, if you're watching this, if you're struggling with your sobriety or if you've relapsed, there are some things you can do to take action now. First of all, do your best to ensure that your living situation is safe and healthy. If there are triggers in your environment, try to remove those triggers. Also, keep the dialogue open with your support system. This is critically important. If you're in AA or NA or in some form of support group for recovery, reach out to the people that you're connected with, your sober support system. If you have a sponsor, reach out to your sponsor. Stay connected daily in order to really continue to maintain and work on your recovery even during these tough times. Let's face it, it's easy to just say, you know, we're all dealing with this problem. It could be a good excuse to continue using or relapsing, and we can justify further use in our mind quite easily right now. But it's critically important that we continue to fight even in the face of this pandemic, because the risk of exacerbating mental health symptoms and accidental overdose are high right now. To make it even worse, people who are suffering from life-threatening conditions such as potential overdose from opiates are deciding not to go to the hospital for fear of contamination from coronavirus. So I want to remind everybody, especially in this area here, that our hospitals are safe. Our hospitals are still functioning. If you are having emergency symptoms and you need help, you need to go to the emergency room, you can go to the emergency room. We've taken every precaution, and you will be safe. Do not stay at home with a life-threatening condition for fear of coronavirus when you absolutely need emergency services. So continue to use support, continue to reach out to sponsors, reach out to friends and family, as many of us have been doing during this time. But there's also very concrete things you can do if you don't have some of those, or even if you do have some of those support systems. There are many Alcoholics Anonymous and Narcotics Anonymous support groups that are now being offered virtually online. I did a search just recently at aapeoria.org/meetings and a couple days ago, and there were at least 11 meetings in that one day. So there is a lot of resources that have gone up, and a lot of resources for people who are struggling right now to seek support virtually through the internet. You can also go to na.org, Narcotics Anonymous, and search Peoria, and you should find a lot of meetings there too. Also, the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, has a tremendous amount of resources on their website, which is www.samhsa.gov, and that's SAMHSA. Once again, www.samhsa.gov, and you can browse their list of resources as well. When I'm speaking to some of my former colleagues and friends who are in recovery themselves, and I asked them what they were doing, a lot of them told me that they were immersing themselves in recovery literature. The Big Book is a very common one, Alcoholics Anonymous. Other friends told me they were engaging in a lot of prayer and meditation. And one quote that a friend of mine said to me that I think that made a lot of sense here is when you're fighting the disease of addiction, at first you may be very motivated to stay sober, you're doing all the right things, but eventually motivation has its own half-life and will start to wear out. And when motivation runs dry, the only thing left is consistency. So he mentioned that once you start to feel less motivated, the consistency part is how you're going to maintain your sobriety long term. So keep doing the things you were doing to stay sober, if not slightly altered. Practicing mindfulness, focusing on the present, also reaching out to providers if additional help is needed. And that's what I'll wrap with today. If you feel like you're struggling and you can't maintain your sobriety, or if you have relapsed recently and you're engaging in dangerous drug use behavior, there is help available. Unity Point Health, Unity Place is one of the few treatment providers in the area that have maintained relatively 100% occupancy and efficiency throughout this. We've closed very few lines of the business. We have inpatient, residential, outpatient services available. We have virtual services, both telephone-based and video conferencing available with individual therapy and group therapy. And you can still get the care and the treatment that you need. If you need inpatient help for drug addiction or substance use or alcohol use disorder, we have that available. If you need outpatient services therapy, we have that available too. You can call our Unity Place Access Center at 1-888-311-0321 or visit us at unityplace.org. I'd be happy to take any questions if we have any.
The amount of people who have, or I guess how you would say, have turned to alcohol or narcotics during this time? I know you said it's somewhat hard to measure, but are there any numbers that point to that middle? You said it's somewhat of an increase and somewhat not.
You're right. It's very difficult to gather that kind of data that quickly. I mean, for example, we're still waiting on the CDC data for overdose deaths in the United States for 2019, which usually comes out in the summer of the next year. So I think the answer to your question basically is, newly formed addictions. I think we'll have some data on that, but it might be quite some time before we see that. One thing that we are seeing nationwide, which has been on my radar and is particularly troubling, is we are seeing once again increases in overdose deaths in the United States in certain pockets of the country, and we really hope to curb that trend, especially here in this area where we have seen a few increases as well. Other questions?
Thank you.